Welcome to the Committee on Health, Human Services, Finance and Policy for today, March 21st, 2019. We do not have a quorum at this time, but out of respect for our author and his testifiers, if we could please start with a general bill introduction. I know there is a significant amendment, but if we could go through the testimony as to the motivation for the language that's before us, and if we do not have a quorum by the time you finish that presentation, we'll recess. But we are working on getting members here.
Thank you, Madam Chair. Then may I put the amendments on first?
We do not have a quorum, so we won't be moving language.
Gotcha.
If you could give us the narrative as to why this bill is important, I would appreciate it.
Okay, in your packets, members and Madam Chair, is my testimony. And you can follow along if you'd like or just listen. This bill is a product of the interim meetings that have been had by the two licensed manufacturers to assess the state of the program and to make any improvements that we have in our cannabis program. The bill makes improvements that enjoy a broad legislative support and reflect a measure of consensus. Our goal is to move legislation that can pass both the House, the Senate, and the governor today. So we acknowledge that the program suffers from many defects that limit patient access and either block or push out patients because of high costs. This bill makes meaningful changes in a way that maximizes chances of legislation and to be a success. The bill is not designated to address every perceived shortcoming, nor does it have anything to do with the debate regarding recreational use. We have witnesses today with the different manufacturers, and we're glad to have them come up, and we also have other witnesses. So if I might say, my heart in this is to have medical marijuana wherever it's needed. If someone's got a prescription and there's a need for a marijuana product, I'd like to be able to help them. And so this is a step more into that direction. So with me today to go through more of the details, and I'll say there are 6 issues that we're working with here. The issue 1 is how manufacturers, how we allow manufacturers to purchase hemp from the state's licensed hemp growers. The second issue is to allow caregivers to administer cannabis on school grounds. The third is to recertification of telemedicine. The fourth is to increase the number of authorized dispensaries. The fifth, to increase patient supply to 90 days versus the 60 days. And issue 6, to authorize special revenue fund appropriation. So to go through those, I've asked a couple of my lobbyist friends to give us more detail on those, if you would allow, Senator, or Madam Chair.
Welcome to the committee. Who would like to go first? Mr. DeLaforest.
Madam Chair and members of the committee, good afternoon. My name is Christopher DeLaforest. For the record, I am here today on behalf of Minnesota Medical Solutions, which is one of the state's 2 licensed medical cannabis manufacturers. I'll be pleased, Madam Chair, to briefly explain 4 issues that are out there. Mr. Lehman can explain the other 4. That makes 8 and not 6. We do have sort of 2 negative issues that are not in the bill. Now, when you do have a quorum, you will move the DE amendment, which I will speak to briefly. Madam Chair and committee members, the first issue you're going to see in that DE amendment has to do with allowing children, minors who are duly enrolled in the state's medical cannabis program, to have their licensed caregivers give them that medicine on school grounds. As you may know, that is currently illegal, which results in a very sort of unjust and certainly onerous situation for many of these caregivers, primarily mothers who are dealing with their sick children. In fact, we have 2 of them here today you will hear from momentarily. I would like the committee to know, Madam Chair, that we are not plowing new ground here. There are other states that do allow medical cannabis on school grounds, approximately 8 of them right now. Moreover, there are off-ramps that you will see in the DE amendment. For example, there is no requirement that school personnel handle medical cannabis. There is no requirement that cannabis be stored on school grounds, for example. The big idea here, what we're trying to do is simply require that a school offer a private and discreet place for caregivers to give their children medical cannabis without the inconvenience and stigma of bundling up those kids in the middle of winter and driving them down the street to a park or behind a strip mall. Madam Chair and members, issue number 2 I'd speak about is this DE amendment will increase the number of dispensaries. Right now, the current law is 1 dispensary per congressional district. We would raise that to 2. The simple reason is that while we would like to see more patients in the program, some of these dispensaries are reaching their capacity limits, and there is a business case to be made for an additional dispensary. There may also be a business case for some more geographic diversity as well. For example, Minnesota Medical Solutions covers the 7th District, and there is quite a bit of inconvenience having 1 facility in Moorhead. Madam Chair and committee members, the third issue that I'd like to raise is this is Senate File 727, authored by Senator Howe, and that would increase the allowable patient possession limit from a 30-day supply of medical cannabis to 90. We see this as a matter of convenience. We see it as a matter of access, especially in rural areas when you have some folks, patients are quite ill or are chronically ill. And remember, it's 1 dispensary per congressional district. They do not have a local pharmacy or mail delivery for their medicine. And Madam Chair, finally, I'd bring up what I'd call kind of a negative issue, something that is no longer in the bill. If committee members would like to learn more about the arcane tax world of IRC code 280E, I would be happy to answer those questions, but it is not in the bill now because Senator Chamberlain is again this year authoring a standalone bill on this subject, and that will travel separately in the world of taxes. Madam Chair, that concludes my portion of the testimony.
Thank you. Mr. Lehman.
Thank you, Madam Chair and members. A few additional provisions in the bill I want to highlight. The first deals with the use of hemp. And just to remind you of what hemp is a plant that looks like marijuana, but is not marijuana. For years, hemp has been illegal for a variety of purposes, although decades ago, back in the beginning of the last century, hemp was commonly used in a very common farm product used in the production of clothing, rope, and other materials. One feature of hemp that is relevant to medical cannabis is that it has cannabinoids, CBD, which is not a chemical that can get a person high, but it can help control seizures and help provide other medical benefits. The other ingredient in marijuana, which is also more commonly known as THC, is the chemical that can make a person high. Hemp does not have a significant amount of that, and if you look in the DE amendment on line 1.8, hemp is not line 1.7, the THC concentration does not have more than 0.3% of hemp. Hemp was legalized in the Farm Bill, U.S. Farm Bill last year. You may recall seeing media discussion of Senator Mitch McConnell, the Senate Majority Leader, pushing hemp, realizing that hemp has a great new, there's an opportunity for farming and the use of hemp in a variety of products. Minnesota authorizes hemp under specific conditions. Persons seeking to grow hemp have to get a license from the Department of Agriculture, and the industry here, hemp industry, is really taking off. And it's good news for a couple of reasons. One, it's good news for farmers in rural areas where hemp is expected to be a very significant new crop and new product and income stream for farmers. And for the 2 manufacturers, medical cannabis manufacturers, it's a good source of CBD. And our hope is, and our goal is, that hemp would be a much cheaper source of CBD than marijuana, which is currently grown in a very restricted, secure environment with security and guards and cameras and razor wire and so forth, whereas hemp is just grown in a field. The majority of our patients use medicines that are CBD dependent. And our patients and all patients have a range of medicines that go from high THC concentrations to a mixture to high CBD concentrations. The majority of ours, again, use CBD extracted medicine. So we see the hemp provisions as a way to allow us to have a cheaper source of CBD and to help our patients have a more affordable product, which is a concern I'm sure you'll have heard about and will continue to hear about. The second provision I'd like to mention deals with telehealth. The committee has had discussions about telehealth over the last several years. I think you're all familiar with the benefits of this, particularly for patients who are in isolated areas, rural areas. The current law requires that patients have a meeting with a licensed practitioner to be certified as having a qualifying condition. Do you have cancer? Do you have MS, et cetera? Under current law, that patient has to come back in annually to be recertified. For a number of those conditions, they will not have gotten over it. They will not be MS-free or free from other medical conditions. And for a number of these patients, it can be a burden to have to travel if there's mobility issues or other issues. The bill provides that patients, upon recertification, can receive that recertification from a licensed practitioner, but the initial certification has to continue to be a face-to-face experience. The third provision, and this is very significant again, I think both for the Department of Health and for patients. Patients, when they register for the program, have to pay a fee. Depending on their income status, if they're on public assistance or not, those ranges vary. The two manufacturers also pay significant license fees, and those dollars don't go directly to the Department of Health, Office of Medical Cannabis. They go into a special revenue fund and need to be appropriated to the department. Over the past several years, those dollars have not been appropriated. And as a result, as the program has grown and the number of patients has increased and the number of patients submitting their paperwork to get an identity card and a registration card has increased, the Department of Health has not had the staff to meet the demand because those dollars have not been appropriated. And so patients who may have been certified, they could benefit from medical cannabis today, may wait weeks or even months to get that paperwork processed. And the very last provision of the Delete Everything Amendment on page 10 provides for appropriating those dollars out of the special revenue fund to the departments. Again, these are dollars that have already been collected. They're sitting there. They're not benefiting the patients and allowing the department to do its good work. And so that's that provision. Finally, members, the fourth provision, again, is something that's not in the bill. The industry has been talking with the department over the fall and the beginning of this year about allowing the two of us to transfer products to each other. If there were a disaster, say a tornado or a fire, and one of our production facilities was destroyed, current law bars us from getting medical cannabis from the other manufacturer. We had interest in doing that just to make sure that there's continuity of supply to patients. We've run into a little wrinkle just in terms of the software of how we track that product. We want to make sure that if we're producing cannabis and medicine at our facility and it's going to an off-site location that's not connected with us, that the Department of Health and we are able to track that appropriately. There's some new software coming online, and I think this is something that you'll see next year once that software gets up and running. But it's not ready yet, but I just wanted to flag that for you. Thank you, members.
Thank you, Senator Hall. We do have a quorum, so members, let's see, who would like to move the bill? If I could have a volunteer. Senator Abler moves Senate File 1070 to be before us. Senator Hall, you have the A1 amendment and an amendment to that amendment. We can incorporate those and treat them as an author's amendment if you wish.
I do wish the A10 and the into the A1.
And members, any questions as to the A10 being incorporated into the A1? Okay, and to the amended, or to the incorporated A1 amendment, all those in favor say aye. Opposed? Senator Hall?
Thank you. So from here, I think we should go into other testifiers. And if I could, if you would want to ask them to come up, Madam Chair.
Thank you.